Namaskar. A very warm welcome to the online portal MOOC, that is Massive Open Online Course on Human Genetics, Module 22B. Genetic diseases and inheritance, patterns, autosomal recessive condition. The main objectives are to understand the basic concept of genetic diseases, to explain the autosomal recessive inheritance patterns, to know about the autosomally inherited disorders, to know about the genetics behind each disorder. Introduction. Inheritance patterns illustrate disease transmission amongst generations of a family. Autosomal recessive inheritance is one of the several ways that a trait, a disorder or disease can be passed from generation to generation. An autosomal recessive condition means two copies of an abnormal gene must be present for the disease or trait to develop. Inheriting a specific disease, a trait, mainly depends on the type of chromosome that is affected. It can be sex and autosomal chromosomes. It is dependent on whether the trait is recessive or dominant. Mutation in a gene on any one of the 22 non-sex chromosomes can lead to an autosomal disorder. Genes usually come in pairs. For recessive condition, two copies of the genes must be defective to cause disease. The person with only one abnormal gene in a pair are called carriers. These people are most often not affected by condition or do not show a phenotype. However, they can pass the abnormal gene to their children. Hence, the patterns of individuals affected with an autosomal recessive disease can be traced through a family to determine which individuals are carriers and which individuals are likely to become harmed. Hence, this episode explained further in the following subheadings: autosomes and inheritance, autosomal recessive inheritance, examples of autosomal recessive disorders, autosomes and the inheritance. Autosomes are the non-sex chromosomes. Humans have 22 pairs of autosomes and a pair of sex chromosomes. The genes which are present in any of the autosomes get inherited to the next generation, then it is termed as the autosomal inheritance. Autosomal inheritance of diseases will affect both male and female children equally. In the case of recessive condition of inheritance, both the copies of the gene should be affected to show the symptoms of the disease. Children with one copy of the altered gene are called as carriers. They carry those genes and inherit that affected gene in the next generation. Hence, the chances of getting affected child are 25%. If both father and mother are in an altered condition, with the genotype capital A and small a, then the children with genotype small a are affected. Two copies of the defective genes are needed to develop the symptoms of the disease. In this case, 25% of chances occur to get the affected children. B. Autosomal recessive inheritance. The autosomal recessive inheritance shows the affected individual with both the copies of the gene are affected. An individual can carry one affected gene, but they do not show any symptoms of the disease. In the case of the recessive condition, both the copies of the gene should be affected to express the phenotypic changes. If a carrier man marries a carrier woman where only one copy of the gene is affected, then in the next generation it shows that one affected child and the other children are unaffected, including carriers who will not show any symptoms of advanced disease. The easiest way to determine the inheritance pattern of a disease in a family is by looking at a pedigree. The autosomal recessive disease typically affects both males and females equally. The autosomal recessive patterns manifest by skipping generation, as the affected are usually children of unaffected carriers. It is also common to see affected individual with unaffected children. This type of patterns demonstrate horizontal transmission because the affected individuals are often seen more than one child in a family and not in all generations. The affected individuals trace a horizontal line through the pedigree. In contrast, when a family has affected individuals in every generation, this is considered as a vertical transmission where the affected individuals trace multiple vertical lines through the pedigree. Vertical transmission is the characteristic of the autosomal dominant condition. Consanguinity in a family affected with an autosomal recessive condition will often lead to children affected with the condition. The most common situation of the autosomal recessive disease occurs when parents are carriers or heterozygotes. Children of carrier parents have a 25% chance of inheriting the disorder. This value is obtained by using the Punnett square model used in genetics. Each parent has a 50% chance of passing on the disease allele. Using the multiplication rule of probability, there is a 50% chance that the father passes on his disease allele and 50% chance that the mother passes on her disease allele. With the mating of carrier parents, there is 25% chance that the child will be affected, 50% chance that the child would be a carrier and 25% chance that they would be homozygous, dominant and unaffected. The condition of pseudo-dominance is an exception to the horizontal transmission seen in most cases of the autosomal recessive disorders. In pseudodominance, there will be affected individual in more than one generation. It occurs when a carrier parent has a child with an affected person. In this case, there is a 50% chance that the child will be affected and there is a vertical transmission pattern, but this is distinguishable from autosomal dominant traits by tracing the pedigree and looking for autosomal recessive characteristics elsewhere in the pedigree. These characteristics include affected parents who have unaffected children and unaffected parents who have affected children. Testing such as physical exams and laboratory tests used to diagnose many autosomal recessive disorders, so that counseling, management and treatments can commence immediately. Obtaining a family medical history is an integral part of the diagnostic process, as the clinical phenotype and inheritance pattern can provide essential information about which genes require testing and which technology to use. Phenylketonuria, cystic fibrosis, sickle cell anemia and Tay-Sachs diseases are some of the examples of autosomal recessive disorders. Examples of autosomal recessive disorders. Phenylketonuria is also called as PKU. PKU is an inherited inborn error of metabolism. The accumulation of phenylalanine amino acid causes this disorder. In this disorder, the gene responsible for the formation of the enzyme helps in the phenylalanine metabolism is absent. The gene affected in PKU is PAH. This gene is located on the long arm of chromosome 12. This gene will encode an enzyme called phenylalanine hydroxylase. This enzyme will convert the phenylalanine into other components which are essential for the body function. The defect in the gene PAH will result in the abnormal function of the enzyme. Hence, there will be the accumulation of this amino acid in the tissues and will affect the organs. Collection of this amino acid will turn it into toxic substance. Some of the organs like the brain are more sensitive to this amino acid and the toxic effect will damage the brain function. The consumption of diet having more concentration of phenylalanine will lead to severe effects by the absence of phenylalanine hydroxylase. The symptoms of this disorder will show up in early age of development. In an untreated condition, they can show the following changes in the development: intellectual abnormalities, developmental defects, changes in behavior, musty odor by the excess phenylalanine in the body, skin problems, light pigmentation of the skin, the slow rate of growth, microcephaly, small size head with normal size. The two affected copies of gene PAH will show the symptoms of this disorder. Unaffected carriers will not develop any symptoms. The occurrence of this disease varies among different ethnic groups and regions across the world. The frequency of occurrence in the United States is 1 in 10,000 to 15,000 new births. The symptoms can be detected and screened at an early age. It can be diagnosed in early ages, hence the severe symptoms are rarely seen. Diagnosis and treatment. This condition of PKU can be diagnosed after the delivery of the child. The samples like blood can be taken and tested for the presence of an enzyme which helps in the metabolism of phenylalanine. The test can also be done to check the level of phenylalanine to confirm the disorder and can start the medications. Diet is one of the best treatments for this metabolic disorder. A balanced diet can be given without the high protein content, which usually consists of phenylalanine. Some of the foods are already made which are suitable for PKU condition. These food items normally lack the amino acid phenylalanine. The affected individual should develop a diet plan to prevent PKU symptoms. Sapropterin is one of the medicines approved for the PKU, and it will reduce the phenylalanine level inside the body. 2. Cystic fibrosis. This is the condition caused by the mutation in the gene called CFTR. This gene locates in chromosome 7 and encodes for the CFTR protein. This protein helps in the formation of the channels across the membrane, and this channel helps the chloride ion movement in and out of the cells. By this way, these ions aid in the control of the movement of water inside the tissue and make the mucus thinner and able to flow inside the membrane. When this gene gets affected due to the mutation, the functions of the protein gets affected. There will not be a proper function of the channels of the membrane and ion exchange. This will result in the stop of water movement inside the membrane. The mucus will become thicker inside the mucous membrane of pancreas, lungs and other mucus producing organs. The thick mucus can block the airways of the lungs and leads to lung injury. Similarly, other mucus producing organs get affected. This condition varies across the world, and it shows the prevalence of cystic fibrosis is rare in Asia. In the United States, 1 in every 3,500 births, and in Europe 1 in every 2,000, and new births are found to be affected. Sickle cell anemia. It is the disorder caused by the mutation in the gene called HBB. This disorder mainly affects the formation and function of the hemoglobin. The HBB gene will help in the formation of beta globin. This beta globin is one of the subunits of hemoglobin. Defect in the gene will result in the abnormal structure of this subunit of hemoglobin. This defect in the hemoglobin will result in the formation of malfunctioned red blood cells. This forms the sickle shape of the cells. Later they will die. The absence of red blood cells will result in severe anemia and other complications. Damages in the red blood cells occur prematurely. Individuals will be susceptible to some infection and suffer from joint pains. This condition affects millions across the world, including some of the common group of people whose ancestors are from South America, Saudi Arabia, India and other Mediterranean countries. It affects around 72,000 people in the USA and the ancestors belong to Africa. 1 in every 500 African American births shows this condition. 4. Tay-Sachs disease. This is another well-known autosomal recessive early onset disorder. This disease mainly associated with the progress destruction of nerve cells in the brain and spinal cord. This disease is very rare in the general population. The genetic mutations that cause this disease are more prevalent in Eastern and Central European, certain French Canadian communities, Ashkenazi Jewish population and Louisiana Cajun. This disease results from a mutations in the hexa gene. This gene locates in the long arm of chromosome 15. The hexa gene encodes the protein called beta hexosaminidase A, which is present in lysosomes. A deficiency of beta hexosaminidase causes a buildup of gangliosides in the brain and thus result in brain and spinal damage. Carriers of this disorder are phenotypically unaffected. One wild type hexa allele can produce enough beta hexosaminidase enzyme to cleave the gangliosides in the brain. These individuals are therefore considered to be haploinsufficient, where half the amount of the enzyme activity is enough. To conclude, the field of genetics is rapidly growing as we understand that more and more diseases have an underlying genetic cause. With services that guide parents on their reproductive risk, the medical field is improving the non-clinical realms of treatment options. In the case of autosomal recessive disorders, consanguinity proves to be one of the most significant risks. Healthcare providers should encourage genetic counseling for their patients, especially patients with highly consanguineous communities. Thank you.